And joining us this morning on Studio 3, we have Dr. Christen Simpson from Simpson Dental. Thanks so much for taking time to talk with us.
Of course. Thanks for having me.
Yeah. So let's start off and talk about dental insurance. What is it and why is it so important?
Well, dental insurance can be kind of confusing to people because it does work a little bit different than medical insurance. So we're going to go over some of the differences between the two types of insurances and some things to consider if you are looking to get insurance, what to keep in mind about it. So the first thing about dental insurance is it does help if you're getting just regular preventive treatment. So it'll cover things like cleanings and smaller preventative treatments. So they normally will cover your 2 cleanings a year and any type of fillings that you might need. But a lot of times when it comes to bigger procedures, they aren't as good at covering those. So that's where you need to check and see, what type of benefits you have there.
And let's talk about the cost. Are you finding that we're paying more now for insurance than we have before?
That's right, yes. So it's pretty surprising that really the dental insurance benefits of what they pay for the treatments hasn't really changed much. So in this graph you can see that the coverage is that bottom line that goes straight across that hasn't changed at all. The premiums is that red line, so the premiums that you're paying for the insurance has increased, and then the yellow is the cost of dental treatment. So, the insurance really has not kept up with the increase in price of, what dentistry costs these days. So there is quite a discrepancy there.
And are you finding that we can pick our own insurance?
Well, it kind of depends. A lot of times when it comes to insurances, your employer will pick the type of insurance that you're getting, and you really don't have a whole lot of say in it. You just kind of are added to the plan that the employer's already chosen for the company. So, you want to make sure you're talking to your employer to make sure you know what type of benefits you have when it comes to your insurance coverage.
Right. And talk about, do you feel like insurance has our best interest in mind?
Well, a lot of times insurance just plans on you having that coverage for about 5 years because they think you'll either switch jobs or drop the insurance and be covered by someone else. So they predict that your treatment will need to last 5 years. So really do minimal treatment is what they'll cover. And when it comes to dentistry, there's so many different types of materials that you can use, and if you're picking stronger materials, of course it'll be a little bit more of an investment on the front end, but then they're going to last you. So if you want things that are going to last 20 years, you need to get the stronger materials, and of course that's probably not what your insurance is going to cover.
Ah, okay. And here's one. Is dental insurance the same as medical insurance?
So here's where we could talk a little bit about the difference between medical and dental. So when it comes to medical insurance, you pay a little bit at the beginning and then they cover the rest. So they'll cover the bigger procedures, you just pay a little bit of the deductible. When it comes to dental insurance, it works kind of the opposite. They pay a little bit at the beginning and then you pay the rest, which is the bigger portion. So it's pretty much the opposite and really not covering as much for larger procedures. That's why I said at the beginning, they cover the smaller procedures like cleaning and preventative treatment, but a lot of times not the bigger things.
Yeah, the expensive things. So for in-network providers, do they go off of what the insurance wants instead of the patient?
So yes, so when you're in network, it means that you have to choose what the insurance has picked to pay to do for the patient. As an out-of-network provider, you can do what's best for the patient. So, an out-of-network provider, we do longer-lasting treatments for patients, and we can still get some of the benefits, normally the max even in some cases of what the insurance will cover, and still be able to do the longer-lasting treatments for the patients.
Should we let our insurance dictate what dentists we see? Because this is a tough one. We find it even just in our medical coverage insurance.
Right. So, I mean, I think it's really best if you choose your dentist based on who's going to do the best treatment for you. You really don't want your insurance to dictate the quality of care that you're going to get. So, you want to choose someone that you know is going to do procedures that are going to last for you and invest in those dental procedures that are quality care.
So it sounds like we really need to do our research, but you've done a lot of that for us. So great talking with you today, Dr. Simpson.
Well, thank you.